My name is Alice Villatoro. I am a research assistant professor at the Latino Research Institute. I have my PhD in health services, and I've been working at the LRI for the past 4 years. So a lot of my research centers on understanding mental health services among Latinx communities. And so ever since I kind of started my doctoral studies, I've always been interested in how I can help the Latinx community, and one of those things was through research. So we really wanted to understand how the change from in-person learning to remote learning really affected college students in Texas, from not just their physical health, but also their mental health. Since we are talking about some COVID measures that involved isolating yourself from others and becoming socially distant and staying at home, we did see a decline in self-rated mental health. So the Texas college students were asked before the pandemic, that is before March 2020, how would they rate their mental health? Would it be excellent, very good, good, fair, or poor? And then they would also rate it again after March 2020. And what we saw is that there was a significant decline between March 2020 and then before March 2020 and after March 2020. And we did find that 25% of our college student sample was experiencing serious psychological distress. So this is distressing behaviors on an almost daily basis. I think it's important that institutions of higher education really try to implement more services for their students. I know that there were a lot of schools that were making virtual mental health visits a thing. So expanding telemedicine, I think, would be a great thing for students. Increasing peer support groups. I know that, having a virtual space to share your concerns or your problems with other students who are also going through something similar can be very cathartic and therapeutic. So, making sure that you open up spaces for students to really talk about these issues in a safe environment, whether that's virtual or in person.